Welcome back, Alessandra. I understand that you have some troubles with your abdominal area, so I'm going to be performing an abdominal assessment for you today. Tell me a little bit about what's going on with you.
Yeah, so I've been feeling a lot of pain in my abdomen for about 2 months now. About 2 months ago, I went on a beach trip with some friends, and I decided to get my belly button pierced. And I'm really concerned that something's going on there because of that, because they said the pain would only last about 2 weeks to a month tops, and now it's been 2 months, so I'm just concerned about what's going on.
Yeah, definitely a piercing should not be sore for more than a couple of weeks. So it's been 2 months and you're still feeling pain. On a scale of 1 to 10, how intense is the pain?
Honestly, it's about an 8.5.
Okay, so that is significant. Have you noticed any discharge coming out of the belly button?
No.
Okay. No discharge. Any redness?
Not that I've noticed.
Okay. Is it more painful when you press down on your belly button or on your tummy?
No, definitely yes. I don't like any pressure on it.
Okay. Are you able to bend down and tie your shoelaces if you have to, or dress yourself?
I mean, yes, but it is painful because when I have to bend down, I do interact with it, so.
Okay. So you're generally trying to avoid that
Yes.
downward motion. Okay. Do you remember if the instruments that were used to penetrate the skin were sterile? Were they removed from a sterile pouch?
To be honest, looking back on it, I don't think it was sanitized that well. I just really want to get my belly button pierced, and I didn't really care about anything else. And I know that's stupid, but I think.
Yeah, no worries. It can happen, definitely. So you're not sure about the sterility of the instruments. Most likely, probably they were not disinfected. So there could be an infection going on. Okay, made a note of that. Are you on any medication right now, Alessandra?
No.
No medication. Any allergies?
No.
Any pain anywhere else on your body? Your back, arms, legs?
No, it's just really there, only there.
Okay. Do you feel any tingling sensations or any numbness anywhere on your body, such as your arms, your chest, legs?
Yes, actually, which is kind of concerning. I feel some numbness on my lower abdomen, and then I have some tingles in my chest.
Okay.
So I don't know what that's from.
Do you feel like they radiate from the belly button area, or do they just happen independently from the...
I feel it does radiate.
Okay. So that's important to note down. So tingling in the chest. And then you mentioned the lower abdomen.
Mm-hmm.
Okay. Okay, let's go ahead and check out your dermatomes to begin with, to make sure that I perform a neurological assessment and that there's nothing going on that may indicate a disorder of your cranial nerves, and then I'll focus on your abdomen.
Thank you.
Okay. I'm gonna go ahead and put my gloves on. And do you feel the pain right now?
Yes.
Okay. Let me just go ahead and palpate your abdomen around the belly button. So I'm not going to touch the belly button just yet. I just want to feel for any masses from this position. Okay. Sometimes the upper abdominal wall can be better felt when the patient is in the upright position. Okay. Good. So I'm not feeling anything. No masses felt in the upper abdominal wall. Okay. So let's go ahead and get your vital signs. Starting off with the temperature, 97.8. $99.4. Let me repeat that. 99.3. So you have a slight fever, not yet full-blown fever, but may indicate the beginning of an infection. Okay, let's check your oxygenation. I can rest that there. 99% oxygenation and 80 beats per minute. That's good. Let me check your pulse manually. Okay, good. Brachial pulse, checking for the character of the pulse. Good. And radially. Good. All right. I'm going to go ahead and listen to your heart. Go ahead and breathe normally. I'm also going to use the bell side. Good. I'm not hearing S1 or S2. The heart is strong, normal rhythm, about 80 beats per minute. Good. Take a deep breath in and out. Okay. Good. Deep breath in and out. Okay, can breathe normally now. So heart and lungs are normal. Normal oxygenation, 80 beats per minute heart rate, S1 and S2, present, S4, S5, absent. Okay. Go ahead and check your blood pressure. Go ahead and just relax. Good. 120/65, which is perfect. Next up, I'd also like to check your ears and your eyes. Starting with your ears. Have you noticed anything abnormal?
Actually, yeah. My eyes have been a little watery, like more than normal.
Okay.
And then for my ears, they do feel a little off. I have been swimming, so it's probably because of that. But it's nothing too much of a concern, but definitely out of the norm.
Okay. So let's rule out any infection then.
Okay.
I'm gonna start by just palpating the mastate bone process behind your ear. And the preauricular lymph node. I'm not noting any swellness or anything abnormal. Okay, you can close your eyes. Yeah. And just relax. Okay. Right, let's take a look inside the ear. I'm gonna start with your right ear, so if you can look towards your left. Good, perfect. Gonna take a peek inside at the tympanic membrane, which I can clearly visualize. It is pearly gray, well-defined margins, bony landmarks are present. Just a small amount of wax build up, but nothing concerning and no abnormal discharge. Okay, so this here looks good. I'm going to take a look at this other one. Okay. Good. No signs of any infection. I'm gonna start with number 8. You can open your eyes now and look into the distance. I'm going to take a look at your optic disc and optic nerve. Perfect. Now I'm going to check for jaundice. Good. Check this other eye too for jaundice. Good. And check the optic disc on your left eye. Okay, looks normal. I'm going to start checking your cranial nerves. So I want you to keep your eyes closed and tell me if you hear a sound moving towards you or away from you.
Towards.
Okay.
Away. Towards. Towards. Away. Away.
And now do you hear the sound moving from left to right or from right to left?
Right to left. Left to right.
And now is it going up or down?
It's going up. Down.
And now can you point to it? Good. Good, perfect. I'm going to continue focusing on your cranial nerves, and I'm just going to begin by doing a palpation of your body to feel for anything abnormal. Any masses, any lumps or bumps, any changes in the temperature gradient. Temperature is normal, no lumps or bumps felt. going to touch you with a slightly sharp object, and I want you to tell me if you feel it on the left side of your body or the right side.
Right. Left. Left. Right. Right. Left. Right. Right. Left.
Okay. Now I'm going to touch you with a wet or dry object.
Wet. Dry. Wet. Dry. Wet. Wet. Dry. Wet. Dry. 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 Wet. Dry. 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 Wet. Dry. Wet. Dry.
Okay, next up I'm going to touch you with either a sharper object or a dull object.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. Sharp.
Alright, Alessandra, let's lay down and take a look at your abdomen. Okay, Alessandra, So I'm going to take a look at your abdominal area. Is it okay if I unbutton your pants and lift your top?
Mm-hmm.
Okay. See the belly button here, a little bit of redness around the top of the piercing area. I'm gonna go ahead and begin by just visually inspecting. Okay. Looking at how the skin is reacting to a uniform small amount of pressure. Go ahead and take a closer look at the belly button under normal light. I am seeing a little bit of an inflammation underneath the piercing. There is redness present at the side. A little bit of discharge. There is definitely an infection emerging. Yeah. Okay. So we're definitely going to treat you with antibiotics. I'm gonna go ahead and prep the area so that I can take a sample. Sanitizing. applying the reactant. Around the location. And then applying the reactant at the incision site. Removing a little bit of the discharge and placing it in the container. Making sure that I remove enough of a sample here for the lab analysis to get a good reading. And now cleaning the area. I'm also going to apply disinfectant. Gonna let that sit for a good 30 seconds and then I'll remove the bandage. So we're gonna actually not apply any other bandage over the area because we want it to breathe and we want the air to make contact with the moist surface and dry out the infection. Okay. I'm also going to test the sensitivity on your abdomen. So this is dull and this is sharp. So I want you to say dull or sharp.
Dull, sorry.
You're asleep. It's okay. I'm happy I was able to put you to sleep.
Okay, oh my gosh. Okay. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay. And now I'm going to touch you with 1 or 2 sharp P-point here. Is it 1 or 2?
1, 2. 1, 2. 2.
Good.
2. 1, 2. 1, 2. 2. 2. 2. 2.
Okay.
1.
The redness has decreased and I can see the belly button is not as inflamed as before. Let's leave it to air out. Let's check it again in a few weeks. No more than 2 though.